training is a very critical training for us, because it really talks about not only telehealth laws, but given the COVID-19 emergency state of condition our world's in, it's made a lot of major changes. So I want to jump in and talk some about the objectives for this particular training. We are going to look at an overview of the major laws as it relates to telehealth from a Georgia Composite Board perspective, Department of Health and Human Services, and all the laws that encompass under that umbrella of federal government, like HIPAA rules. We're going to talk some about the Office of Civil Rights and their role in protecting client information and high-tech laws. We're going to also spend some time really talking a lot about COVID-19 is here, what has happened with how we do business from a face-to-face model now to very much of a telehealth model, where we're dependent on technology to help us meet the needs of the clients that we serve. So we are going to talk about updates, and I do have a lot of information in these information slides that we'll share with you all after this training, where you can also read for yourselves and know that the information we're presenting, it will change. And this is the information I have is some of the more current information, and I want you to know I've been doing a lot of training with the Department of Behavioral Health and Developmental Disabilities, our National Association of Social Workers organization, Medicare. Been reading a great deal of information to come up and compile this data, relevant data that you will find, I hope, to be helpful for you as you move more into using telehealth as a means of meeting the needs of your clients. We will certainly look at some of the technology that COVID-19 is recommending that we use during this emergency crisis. We'll also look at Medicare and Medicaid laws and updates. We'll look at fees. Going to be spend a lot of time looking at how the phone is now becoming a really major form of technology to do telehealth. And certainly we'll talk a little bit more about that later in this presentation. We will look at some of the ethical dilemmas as it relates to how technology impact our clients, and what kind of remedies we're going to have to adequately meet the needs of clients, moving from a face-to-face type of treatment model to now doing distant counseling, treatment, meaning the client in one location, you're in another location, and using technology as a means of doing the great work that all of you all do. So we'll look at some of the ethical dilemmas, and then we're going to look we're going to end with looking at, there have been some modification with the laws and regulations as related to the technology that we use, but we're going to end with looking at what HHS need us to do from being in compliance. So we'll walk through some of the process and procedures we need to have in place as we move more into becoming truly telehealth organizations. And then I want to end the session today talking with us a little bit about I attended participated in a recent Emory University panel discussion, and it was titled "The Impact of COVID-19 on the Provision of Behavioral Health Services." And there was a lot of interesting information, and I got a couple of summary I thought valuable topics that could help us with as we look at the work that we're doing and seeing where we are with what the treatment provides, and are we adequately meeting the needs of our clients. And I will share that with you all toward the end of the presentation. I do have a good video that talks about COVID-19 and HIPAA laws, and I think you'll find it to be helpful, and we'll look at it about midway this presentation. So given that, those are the topics for today. And as always, we'll end with questions, and we'll be glad to answer questions as we know them, and then we'll be in with the session by 2:30. So given that, it's imperative that we start out talking about our own local laws, and we're talking about the Georgia Composite Board. We have many of us are licensed, either we're licensed social workers, licensed professional counselors, marriage and family therapists, and we also, not only talking about fully licensed folks, but associate licensed folks. And back in 2015, the Georgia Composite Board moved us to a whole new level with telemental health and developed some rules and regulations around telemental health. And pretty much they came out with a definition. And keep in mind, the Georgia Composite Board worked very closely with uh, uh, the Telehealth Mental Health Institute, which is one of the largest, actually the largest telemental health organization in the United States. And they work closely with SAMHSA, HHS, and they were very instrumental in helping Georgia with coming up with definitions and training for our staff, of which we started to move in that direction, getting telehealth training back in 2015, 2016. So telehealth is just that, it's a means of delivering services via technology. And what we're pretty much saying, we're moving with teleservices, we're moving away from the face-to-face and moving into using technology as a means of our medium of communicating with our clients, meaning the client is in one location and we're in another location. And it says that it makes a telehealth service because it's used via technology, such as the telephone, video, internet, smartphone, tablets, personal phone. All of these are considered tools that we use to communicate with our clients. And I want you to pay attention in that telehealth definition. It says all of these technologies need to have an appropriate encryption. And we're going to talk in just a minute about appropriate encryption. So in other words, we've got to be able to use our technology to make sure it is in compliance according to HIPAA guidelines. Because again, nothing has changed about what components we have to include in our work. And HIPAA says that we have to make sure we protect clients' confidential information. Because when we don't protect it, we are in violation of clients' rights, and we don't want to do that. So when we look at encryption, we're really talking about, in our encryption technology needs to be at least 128 bytes or more. And we're talking not only about our hardware, like the different technology tools I just referenced, but we're also talking about software as well, needs to be HIPAA compliant. But encryption is considered the most effective way to achieve data security. And if we were looking at encryption data, it would look with a lot of symbols and letters, and be very difficult to read it. And that's called decrypting encryption, where we cannot read it. And then we put a password in, and all of us know that we must do passwords and make sure that we change our passwords at least every 60 to 90 days. And once we put that password in there, it decrypts it unencrypted data. In other words, it makes it such that we can read it and it's in legible language. The words are defined and we know what the information says. And encryption is a means of protecting and keeping hackers from exposing or getting a hold of the knowledge of our clients' information. So again, we're talking about technology, it's a certain type of technology, a technology that must have encryption, meet encryption guidelines of at least 128 bytes to meet HIPAA standards. And we're also talking about telehealth. Also, it facilitates, it's very important that we know that it helps with the client self-management and support for the client work and what that they do. And it also involves a couple of terms, synchronous and interaction and asynchronous store and forward transfers. And I'm going to talk a little bit about some key definitions you need to know when we talk about telehealth. And some are familiar and some will be new to some of you. So again, that's what telehealth is, just that, using technology as a means of providing treatment to our clients. It's imperative that we also talk about the definition of technology or telehealth from the Department of Health and Human Services and Resource and Service Administration, and they too have a definition of telehealth. And they define that telehealth is the use of electronic information and telecommunications technologies to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. Again, telehealth is being used not only in behavioral health, but in many, many fields, and I listed some here: dentistry, counseling, physical occupational therapy, home health. All of these organizations, healthcare organizations and organizations are using technology to communicate with their clients. Chronic disease monitoring management, another type of organization that use telehealth. disaster management, consuming professional education. And again, we're seeing that telehealth, especially during this COVID time, pretty much agencies all around the world are using technology as a means of communicating with their customers. So again, this way of doing business is not going to change after COVID-19. We're going to talk a little bit at the end about why we need to work diligently at ensuring that our organization has telehealth clearly defined, has also a way of providing treatment to our clients. You can't talk about our work without talking about Health Insurance Portability and Accountability Act, better known as HIPAA. This law came about through the U.S. Department of Health and Human Services, and this is just a reminder. I know we know this, but it's always good to review information because there's been additional laws added to HIPAA since 1996. And the purpose of HIPAA is just that it's designed to protect client information, and it has a lot of privacy rules called covered entity, as well as standards for individual privacy rights to understand and control how the health information is used. So again, HIPAA job is to protect the client's rights, and if we are providing services, we got to ensure that our organizations are doing whatever it takes to make sure clients' information is protected. Another key organization I want us to be reminded of, we don't talk about them as much, is the Office for Civil Rights. And HIPAA, keep in mind, we're looking at the order of this thing, the Health and Human Services are the oversight managers of HIPAA, and HIPAA has the Office for Civil Rights, OCR, who is responsible for the implementing and enforcing the privacy rules with respect to voluntary compliance activities and civil monies and penalties. So we're talking about HIPAA laws, we're talking about OCR, who actually, they have the very really broad task of ensuring that we as providers of services and treating clients that pretty much that we are in compliance with following privacy rules. And then another, in a minute, I'm going to talk about a fourth law under that whole health HHS group, High Tech Act. We'll talk about that in a minute. But I want to just remind us, you all, of HIPAA rules. HIPAA is responsible for, and when we say HIPAA rules, that means these are rules we must ensure that we're in compliance with in our organizations, that we're following these rules to meet HIPAA standards. Access control, audit control. These are things that we must have included in our organization, day-to-day organizations. Not only auditing of our records and for compliance purposes and certainly funding source purposes, but also we must also make sure we're protecting information, make sure we have built-in timelines when we update our passwords, authentications like PIN numbers in addition to passwords. These are all ways of protecting client information. Another way we protect client information is through VPN firewalls. All of these are just saying that we're protecting the client privacy and their information. We're going to talk some about a few years ago, the state of Georgia said that, you know, we had to operationalize the electronic medical record. I hope we're all doing that because it is a safe way to ensure that we protect client information. The business associate agreement, we're going to talk a little about what is a business associate agreement and why is it necessary when we look at following HIPAA laws, especially when we talk about using technology. Our risk analysis, our workstation security. And I'd like to pause here and talk a little bit about workstation security because many of us are working from home now. It's a lot easier to set up office when you're in an office environment and protect client information. But I want us to really think about our workstation. It's imperative, and I can't say it enough, imperative that wherever we're working from our home, it's a private area where our family members, our children, grandchildren, significant others don't have access to our laptops and client information. In my office, there are two of us here, and when I'm going into training, I close my door, I put a sign out, because again, I really value the protection of people information, and I'm suggesting that we all have to do that. So look at your workstation and how confidential is it? Do you have a closed door? Do people know when you're at work? Do you have a sign out saying that you're at work, you're doing counseling with a client? Are you protecting your passwords as close as you are if you were in the office? Are you having a lot of interruptions? Keep in mind, when we're working from home, our employees expect us to do the work, expect us to be professional with regards to the type of technology we use. So please check your workstation and make sure that they're as safe and compliant as possible, because what we don't want is our family members to have access to client information. And of course, device and media control. And you all, I put the source down there because HIPAA has a really great compliance checklist that really lists just all the type of training organizations should be providing with their staff yearly. And it is a requirement that staff provide annual HIPAA compliance training. And this checklist is just a really good tool to use. I had referenced a few minutes ago that we've been talking about the HHS, we've been talking about the Office of Civil Rights, we've been talking about this privacy. Then came another law under the umbrella of HIPAA called the Health Information Technology for Economic and Clinical Health, better known as the HITECH 2010 law. It was actually signed as part of the American Recovery and Reinvestment Act of 2009. And I think you all know that former president who actually signed off it, former President Barack Obama actually signed the HITECH Act into law. And pretty much what it does is it's designed to protect our technology, to ensure that we are meeting HIPAA standards, meaning that we have our technology encrypted, meaning that we have business associate agreements. It also covers state statutes related to suicidality, homicidality, child elder abuse, and other state laws like substance abuse and minor. But again, it also is a very strong part of the team of OCR. And as you can tell there, this law is designed, is called, another language we use when we talk about HITECH Act is called Electronic Protected Health Information. And what it does is just widens the scope of security protection. And when we are out of compliance, we can actually, this can result in some legal liabilities. And I do want us to know that the HITECH Act team are now actually auditing an organization to see that if you call yourself a telehealth organization, do you actually, is your technology meeting standards? Do you have the right encryption? Do you have the right business associate agreement? And they're finding folks. What I'm hoping is they don't come to Georgia, because we're fairly new at this and we need a little more time. We really do, to get more comfortable with the requirements. And you all, I just wanted to, you all just kind of give you a kind of master list of the type of technology we use in telehealth, and I certainly won't go through all of them. I talked about them earlier. And the key thing to remember that you need to ensure that your technology is encrypted. I want to just talk about, there are of course a plethora of definitions when we talk about telehealth, but there's some key definitions I just really want us to be real clear about, because we're going to see these definitions as we move more into doing telehealth treatment. Asynchronous storing forward means the transmission of a client's information from an originating site to a licensee at a distant site without the presence of the client. So again, we talk about moving information only from one site to another site. Now, the big one for us is synchronous interaction, because this is what we've been hearing a lot of language about, real time. And that's when we're talking about doing treatment. It's when the licensee is delivering services to the client. The client is in one location and you're in another location, and you're actually doing a treatment. And these terms are going to become very important to us, because as we advance more into using technology, we're going to have to become certified, and we're hearing more language about getting certified in telehealth. Licensee is just that, meaning folks who are licensed in the state of Georgia. We're talking about social work, licensed marriage and family therapists, and licensed professional counselors. And when we say licensed, we're talking about not only fully licensed folks, but associate licensed folks in these particular uh, um, uh, fields of study. And then originating site means a site where a client is located at the time the telemental health services are provided via technology assisted media, where the asynchronous store and forward service originated. So again, originating site is going to be important because it's actually where the client is located at the time of the telemental health services. And there are a lot of rules around, can we provide telehealth services out of state, you know, what can we do? And at this point, that has not been approved, although during COVID-19, we are here in places like California, are making some exceptions to other states providing telemental health services to their clients. Again, lots to know about that. I know the Telehealth Institute is working diligently with what they call PACT, P-A-C-T, and that's a law they're trying to move in the place where us folks who are licensed will actually be able to practice telehealth in other states. Now, of course, that comes with a lot of rules and regulations, and of course, they've got to vet and determine what qualifications we're going to need to cross practice telehealth in other states. So again, I want to just kind of give you some five key general terms you hear a lot of, so you'll be familiar with them because you will hear them a lot. Now let's jump into the thrust of this training, and that is the COVID change with the HIPAA COVID laws. We know that this law came in, some of the laws around our technology came into effect as a result of COVID-19. And I just want to read this first grid, and I promise I'm going to summarize some of the other ones. But the Office of Civil Rights at the Department of Health and Human Services is responsible for enforcing certain regulations issued under the Health Insurance Portability and Accountability Act of 1996, HIPAA, has amended by the Health Information Technology for Economic and Clinical Health High-Tech Act to do the following: protect the privacy and security of protected health information, namely the HIPAA privacy, security, and breach notification rules. So what am I saying? What I'm saying in essence is that OCR is going to be making, has made some, with the guidance of the Department of Service, some critical rules as it relates to the technology and protecting the information. And I'm going to just jump into that in just a minute. You can see here, this COVID-19 world states, it says common telehealth policy charges, changes through executive agency order, meaning HHS made some major changes about what we can do during this COVID epidemic. For example, allowing home to be an eligible originating site. We've not been able to do that. We are actually now working from home, and our client, and we're actually the technology to reach out to our clients, and we're allowing more telephone to be used to provide services. And that's one of the major things that's come out of laws that's come out of COVID world stats, allowing us to work from home, allowing us to use telephones as a primary means. Of course, the idea is to do video because it is considered one of the best methods of providing telehealth. But telephone is being used as a medium of reaching out to our clients and providing treatment. And there's some rules that are different for Medicare and Medicaid as related to the phone, and we're going to get into that in a little bit. Requiring health plans, managed care, and private to cover telehealth services and offer parity. And parity, we're talking about fairness, making sure that we're able to provide services equally to our clients. Because again, these are difficult times for our clients. So new rules, very critical that we be aware of. COVID-19 has a nationwide public health emergency. And what it's doing is giving us non-public facing remote communication products that is available to community patients. In other words, we are going to be able to use certain technologies without it meeting HIPAA standards. That's what this law is about. And I put the source down so you can read it for yourself. It's pretty clearly stated. And I documented it clearly just as it is written in the HSS laws about these changes. So in other words, OCR is going to be and I want to read this. OCRs and exercise and enforcement discretion to not impose penalties for non-compliance with HIPAA rules in connection with the good faith provision of telehealth using such non-public face audio or video communication products during the COVID-19 nationwide public health emergency. So in other words, we're going to be able to use technology that will not traditionally meet HIPAA standards according to the rules and guidelines. But it's going to be important that we also let our clients know if we're using technology that don't meet typical HIPAA standards, that there is some possibility there could be some leakage in data. And like you, I want to maintain my license, and I want to make sure that I'm ethically in compliance with protecting clients' information. So I want to give you a list of some of the technology tools that we typically have not been able to use. And I want to say also again that during this particular crisis, COVID-19 emergency crisis, OCR is saying that they are not going to impose a penalty for non-compliance with these HIPAA rules. And again, it's because of good faith provision of telehealth during COVID-19. This is a nationwide procedure. So now we'll be able to use video chats, Apple FaceTime, Facebook Messenger video chat, Google Hangout videos, Zoom, and Skype. So again, and we've heard a lot about Skype, and there was something recent about Zoom and leakage of information. I believe there's been some corrections to that. We've just got to pay attention to these particular telehealth tools that we could use. But all of these tools that I have listed here, they're not going to meet encryption, all of the encryption, business associate guidelines, and according to the oversight of HHS, OCR would not penalize us for using these tools. What it's also saying, though, providers are encouraged to notify patients that these third-party applications potentially can cause privacy risks. And we should always strive, although we're given permission by federal government and the people who will actually audit our organization, that it's okay to use them. We should always strive to look for and make sure our technology meet HIPAA encryption and privacy standards. So again, these tools you can now add has tools you can use, or should I say technology you can use to work with our clients. Now, it also, these new laws also says there's some applications that are not acceptable. And what I mean is, please don't use these because it's very clearly stated in HSS guidelines. And again, please read the source. Facebook Live, no, can't use them. Twitch, a live video game website, can't use it to work with our client. TikTok, a short bit-size video app, can't use them. And similar video communication application, public faces should not be used in the provision of telehealth covered by healthcare providers during this COVID-19. And then this law says they've given us all these exceptions to rules and not being penalized. It ends with this. Covered healthcare providers that seek additional privacy protection for telehealth while using video communication products should provide such services through technology that are HIPAA compliant and when entering into HIPAA business or social agreements in connection with the provision of their video communication products. So if you're like me, you're hearing two messages. Yes, you can use these third-party applications that will not meet HIPAA standards, and there are some that are absolutely no-nos, and I've identified those 3 to 4. And then at the end of these revised COVID-19 guidelines, we're then told that we need to do our best as providers of service to make sure that the technology we use is HIPAA compliant, meaning that it's encrypted and it meets the business social agreement. So I bet you're saying, wow, it's saying 2 different things, and it is. So we should certainly, we've got to look out for the best interest of our clients, but we should really strive very hard to make sure that our technology and our software meet HIPAA guidelines. And what HHS also does, it lists a whole plethora of HIPAA compliant alleged, and I want to use that language intentionally, alleged HIPAA compliant videos. And we've heard of some of them: Skype for Business, Microsoft Teams, UpDocs. I hadn't heard of that one. VC I've heard of, and supposed to have a good reputation. Exceeds encryption, I think 256 bytes or more. So it exceeds encryption guidelines. It has a business associate agreement. Zoom for healthcare. We've certainly heard a lot about that over the last 2 to 3 weeks. Doxy.me, I've been aware that it's really good and meet the encryption and business associate, in other words, HIPAA requirements. And for small private practice, there is no cost. Larger companies, I believe, fees are associated with Doxy.me. Google G, Suite Hangout Me, Cisco WebEx, Amazon Chime, I hadn't heard of those. GoToMeetings, heard of that one. And so OCR, HHS listed these particular HIPAA compliant videos, but then they put a disclaimer. OCR has not reviewed these vendors for HIPAA BA compliance, nor does it endorse them. So what that says to us is we've got to look at the ones that they put out there. They're aware of, but they're not endorsing any of them. And it's our job as providers to go out and make sure that whatever video compliant technology we use, that it does meet encryption and HIPAA standards. And what I would suggest you all is, if we go out and Google HIPAA technology, and it'll give a list of all the different types of technology that's supposed to be HIPAA compliant. Take that list, it'll give you information about them. It'll indicate business associate agreement, it'll indicate cost. And then it is our responsibility to contact these organizations and make sure they are who they say they are. Because ultimately it gets down to the proof is on us as providers to ensure that our technologies meet HIPAA standards. You've been hearing me talk about business associate agreements. Again, I'm not going to read all of this, but it does talk about business associate agreement, collaborating with an organization to provide a technical safeguard of your technology to protect the confidentiality, integrity, and availability of the electronic protective health information so that it creates and receives, maintain, or transmit on behalf of the covered entity. It also ensures that subcontractors do due diligence in ensuring that we are reasonably and appropriately safeguarding and protecting client information. And it is important that we also, our business associate, are constantly checking our technology to ensure that we're not having leakage and hackers interfere in our system, and reporting that back to you as the partner in your partnership with them. So again, when we talk about business associate agreement, we're saying that we're going to hire an organization who is agreeing to protect your technology, not only your hardware, but your software, and ensuring that there is no data leakage by hackers, bad passwords, spyware, all the different ways that our technology can be violated. And here's what I like to remind folks of. Some of you may remember several years ago, Emory got very compromised and lost 315,000 of their patients' records. And needless to say, it cost them millions of dollars. And not many of us can afford to pay millions of dollars for a breach of client's confidentiality. That was a very costly, very painful situation for Emory, and I'm talking about Emory, Atlanta. They did not. The disk where the information was stored on was somehow got lost. There were a lot of legalities around it, but you can rest assured it ended up with a great deal of lawsuits. And you all, what I want to do now, we need to be implementing this information in our current policies and procedures, because what we don't know is how long this HIPAA crisis is going to extend itself. And what we do know that it is certainly going to extend beyond April 30th today. So again, I wanted to just have that video, and for folks who like to go back later and look, I did at the right, I have the title of the video and then the actual website. You just copy and paste it. into your web browser, you can certainly review that particular YouTube video again. But again, great information to have. I want to move just a little bit into the Medicaid reimbursement rates. Medicaid, most of Medicaid larger programs are managed through the Department of Behavioral Health and Developmental Disabilities, and they have a 2020 Department of Behavioral Health and Developmental Disabilities Provider Manual that talk about all of the services they provide, and they provide a plethora of services from assessments, diagnosis, nursing, physician, biopsycho assessments, all of the different types of assessments that we typically provide to our clients in behavioral health settings. They also have a plethora of all the different types of services that Medicaid reimburse organizations for, and providers of Medicaid, individual family group, community support individual, Assertive Act community programs, intensive family intervention programs. Again, I could go on and on and on. I used to be a former auditor that worked with APS, so those many types of services I still have the memory of them. And they cover all of the services that our clients pretty much need, including day programs and a whole plethora of substance use disorder services. And they, DBHDD did something with telemental health several years ago, and their telemental health codes will have GT. And when you see GT in front of a code, it says 90843, which I believe is a family therapy session. If it says GT, that means that you can do telemental health, and the state Medicaid will really reimburse you at the same rates. So again, if you're not familiar with the largest organization in Georgia that actually fund Medicaid programs, the good place to learn more about what services are available for our clients. I want to just talk a little bit about some of the changes that's happened with Medicaid reimbursements in general. And according to and I put a source there for you as a reference, provided we reimburse under the applicable categories for service fee schedules, COVID-19 HIPAA rules allows Medicaid providers to use telephone to also provide services during this emergency pandemic. And I say, see updated Department of Health and Development Disabilities guidelines. And if you click on this source at the bottom, it will get into the details. Medicaid has done made a lot of changes during this COVID pandemic to allow clinicians and paraprofessional staff to use the telephone as a primary means, in addition to video conference and other means of providing services to the client, to include individual family assessment. So Medicaid made a huge change with how they typically do business by allowing providers of services to use the telephone as a primary means of services. And one of the advantages of that is a lot of our clients don't necessarily have, especially in rural areas, may not have access to laptops and computers, but most people have telephones. So the good news, it frees up our clinical folks to be able to provide some type of treatment via phone. So it's really good. Back in on March 19th of last month, DBHDD telemedicine telephonic guidelines changed, and they work in conjunction, of course, with the Department of Community Health. Community Health is the oversight manager of DBHDD Medicaid state programs. And pretty much they really, back in March, enforced that all providers, because many folks at that time were no longer working in the office, they were going home to provide the work, and they were given permission. And keep in mind, DBHDD, DCH got the approval from HHS to be able to broaden the scope where providers can use telephones to provide treatment to our client, and also work from home. So as of a couple of days ago, DBHDD is officially extending allowance in this guidance. In other words, it's supposed to be expire meaning they could use telephone from home on April the 39th, it's been extended through the end of the public health emergency period, whenever that happened. In other words, we don't know. So initially in March, it was extended to the point where providers can actually use the telephone to provide infant, family, and other therapies. And then as a couple of days ago, that rule got extended beyond April 30th. And again, I want to point to another tool or reference so you all would know. There is it's important to know that you can go on their website and get this information to confirm that you can continue to use your telephone as a means of providing treatment. And of course, I've moved a little bit quickly into third-party insurance. And of course, what we do know now is that big insurance carriers like Blue Cross Blue Shield, who are really doing some really great stuff. I was reading about some of the work they've been doing since COVID-19, and they are, many of the Blue Cross Blue Shield third-party payers are not charging their clients a co-payment, and $20, $25 can get kind of pricey, given so many people are not working at this time. Aetna, Cigna, United Healthcare, they are now all will pay for telehealth services. So again, if you are you're on third-party insurance panels, you really want to be talking with your insurance carriers to see what type of technology you can use during these times. And there are a lot of exceptions being made. So when we look at Medicare reimbursement, so we've already seen that Medicaid has made a lot of revisions by the use of telephone to provide treatment to our clients. We also are aware that third-party payers are also making some revision, and I'm strongly encourage us to talk with our third-party insurance payers to see what we can and can't do as it relates to technology. Now, when we look at Medicare, Medicare continues to, like Medicaid, they also provide, allow people who can actually bill for these services to provide telehealth services. And I listed some of them. Individual psychotherapy, psychiatric interviews, pharmacological management, smoking cessation. But I wanted to be clear that all providers, because you're licensed, all providers cannot provide Medicare service. And I want to make sure I give you a list of the people, the special people who can actually render behavioral health services to our clients. And that those folks are physicians, psychiatrists, licensed psychologists, nurse practitioners who are master level, and licensed clinical social workers. Licensed clinical social workers are the only master level, fully licensed folks who can actually provide Medicare services to our clients and get reimbursed for them. I also want to give you an update on Medicare, and this information came out, gosh, a few days ago through NASW, our national chapter, through our policy division, and they work closely also with HHS. Because Medicare codes, the telephonic evaluation and management, EM codes, have typically caused a lot of confusion for social workers and was not a covered benefit, although it's a mental health and medical evaluation codes. But during this time of the national emergency pandemic, Medicare has made some exception to the rules, and it says now LCSWs can actually use the evaluation management EM codes for the purpose of up to 10 minutes at a time and up to 21 minutes over a 7-day period. So again, what are they saying? They're saying that licensed clinical social workers can use this code, the EM code, just for evaluation and management of a client. That's it. For up to 10 minutes at a time and no more than 21 minutes over a 7-day period. I have no idea why 21 minutes, but what I am clear is that they've documented it, and we need to make sure that those of us who are licensed social workers who are treating clients in behavioral health need to adhere to these timelines. What Medicare is also saying that they are not approving phone counseling at this point. They're not approving phone counseling at this point. And again, I put a link there for you to get additional information. I also came across this really, I've just been doing a lot of research, participating in a lot of webinars, and it's just been very beneficial. And I came across COVID-19 updated Medicaid and Medicare laws as it relates to oversight and telephone treatment. And it's really, you all, a really good video. Unfortunately, time would not allow us to view it during this particular training today. But I put the link to the video there, highlighted in the bright yellow looking letters. And if you click there and click on the first video, and it's probably about 20 minutes, and it's not only, does it have a narrator, but it also has the actual slides, and it really just talks a lot about providing telephone treatment, and it also talks about fees from Medicare and Medicaid perspective. And again, very reputable, in partnership with Medicare and Medicaid laws. And I think you'll find it to be very helpful as a tool to help you as you move more into becoming true telehealth providers using telephone. We must look at some of the complexities of treatment as we look at telemental health. There's no way around it. That is a different way of how we do our business. We have to look at the theory models that we use and what's the best theory models to use when working with this population, and just changing from a face-to-face where the clients are with us, and then now we're doing it from a distance. We've got to look at looking at depression inventory tools. We got to look at our biopsychosocial assessments, because those assessments are anywhere from 8 to 12 pages long. And are we really going to continue? Are we going to be able really to be able to use the technology? Given the lengthy paperwork, we don't know the answers to that yet. We got to figure that out. We know that online therapy is not the same as face-to-face counseling. We got to get used to not having our clients in our sitting right across from us. We got to be able to look at incorporating the federal and state laws and regulations, in addition to our code of ethics and professional guidelines, into this whole thing of teletherapy. So what we are clear about, nothing changes about how we do business. We still have to protect the privacy of our clients. We still have to follow our codes of ethics. Nothing has changed about that. We're merely talking about how we're going to use our technology to meet the needs of our clients. We got to also acknowledge some of the limitations. It's really hard because we got to be honest about the confidentiality of client information, and we're going to put various laws in place, and we're going to adhere to them. But confidentiality and technology is not 100% of being able to protect information all the time. We got to make sure that we just show our policies and procedures and enforce them within our organization around our technology. It's important to help them understand that the counseling process looks very different. We're not going to be able to pick up on verbal cues, things that we observe in counseling. All those pose limitations to the counseling process. Professional boundaries is another thing that we have to look at when we look at distant counseling. We got to maintain our professional relationships with our clients. We've got to make sure that we are following our rules and regulations of our organization. If our workplace say we work from 8 to 5, if we work from 8 to 5. When we give out our confidential, our phone numbers to our clients, they feel they can call us at any time. We've got to be able to adhere to rules within the organization. We got to recognize that we shouldn't community different electronically. We shouldn't be engaging in inviting our clients to be a part of our Facebook page, our LinkedIn page. This is a professional relationship. We got to be able to really work real hard at helping them understand that there are verbal and there are nonverbal cues to this work. And we've got to make sure that when there are misunderstandings, when even in the communication and even in talking about treatment, when there are misunderstandings, be able to talk about it and talk through it. Voice tone, all of those are just some things we got to look at when we look at the communication in and of itself. And this work is not without ethical dilemmas. And this is a study I wanted to just kind of do some high overviews because they really talk about some of the ethical dilemmas with the technology. And this is a study done by the National Center for Biotechnology Information, and they work in conjunction with the U.S. National Medicine Library. And these are some of the data that's coming out about telehealth and ethical dilemmas. And I want to focus on some of the ones that we will have some difficulties with: the technology and ensuring that the technology is safe, it's encrypted, and has business associate agreement. The confidentiality and security, we've been talking about that, making sure that we protect the security, the data. And then, of course, informed consent. So the technology, confidentiality, informed consent are some of the key areas where that we've got to make sure that we are protecting ourselves. Because at the end of the day, we have licenses and we have some obligations to ensure that we protect clients' information. This was just some of the research from that same particular research, the technology around telephone, internet servers, email, the doctor-patient relationship. All of these are potential ethical dilemmas. Data confidentiality, security, informed consent, making sure that before we engage in using technology, that we make sure we get informed consents. And what was interesting with the Department of Behavioral Health and Developmental Disabilities, during March, it was decided instead of trying to get a written informed consent, meaning getting permission to use the technology as a medium of treatment, providers are allowed to get verbal consents. And of course, after COVID-19 is over, we're going to have to make sure we get informed consent, giving us permission to use technology to actually provide treatment. And again, you all, I gave you the source for this particular article. It has some good information just about ethics and some concerns we've got to be familiar with. And I want to kind of wrap up talking about HIPAA compliant technology. And I know we've been given a lot of leniency by HIPAA and OCR, Office of Civil Rights, and of course, with the oversight of HHS. But HIPAA compliant technology says that we must do the following. Technology must meet encryption standard that must be at a minimum of 128 bytes. That's critical, and we should always strive to do that, even in these times. We must have business associate agreements, and we must get out on the HIPAA websites and find out what particular video conferencing technology will meet standards. It is imperative that we get clients, although from the Medicaid side of the house, clients can do a verbal informed consent, but we need to get written informed consent, and those written informed consent should not only be for to use technology with our clients, but also we're doing video supervision, tele-supervision. We need to get written consents for the people we supervise if we're going to be doing tele-supervision. It is necessary that we adhere to all of the Composite Board, National Association of Social Workers, Licensed Professional Counseling Association, Licensed Marriage and Family Therapists Association, and other substance disorder certification codes of ethics. These you all are must that we must do in order to be in full compliance with HIPAA guidelines. It's imperative that we adhere to confidential and federal laws. And while the Department of Health and Human Services has given us permission. So again, as we wrap up today, I need us to know that there are rules, that HIPAA rules, we should always strive to follow those rules. It's imperative that we follow them. I've listed some key processes we need to have in place. And although the Department of Health and Human Services has given us some waivers, some of these rules because of COVID-19, we should always strive to meet the standards, and we must keep our clients informed about these changes, and there is a possibility of data leakage. And y'all, just a couple of nuggets I want to share with you. I participated in a webinar just recently. It was done by Emory. It was a panel discussion webinar, and some things for us to think about as we move further into COVID-19, and just information we need to be aware of. And this particular group of panelists was made up of doctors, psychologists, but definitely folks who work in the medical and the mental health field. And Dr. Dorian Landis talked about some of the long-term effects of COVID-19, and I really want to bring to our attention as we wrap up for the day, some of the possible long-term effects of COVID-19 is an increase in suicide and increase in domestic violence, because we're keeping our eyes off those high-risk families, danger of social isolation of clients and families, economic conditions, lack of employment, financial problems, housing problems, concerns about the availability of firearms. And I don't know if you all know, but during March 2020, there were more guns purchased in the United States than ever before. So people have easier access to guns, and firearms are still the #1 way in which people commit suicide. A lack of community involvement, church, sports, and other activities that really keep us balanced, excessive worry and anxiety by clients and family members. These are some of the things he said that we really, really need to be really paying attention to and helping our clients with, because they are problems. And then Dr. Clancy, who was an MD, and he had a really good perspective during this dialogue about COVID-19. He said he has fears around an increase in patient anxiety level and fear of the unknown. And he said that one of the things, his takeaway is he has more empathy for clients that he serves. And then some of the advantages, y'all, as we look at in this session today, we'll be able to utilize technology to reach more clients. We will reach more underserved individuals, more accessibility to services. We'll be able to use our phones. Although many of our clients don't have laptops, but they have phones. They will be able to reach out to our clients that way. The no-show rates are much lower. We know that's probably going to change as the economy changes. Healthcare professionals are becoming more creative and demonstrate flexibility with our clients and the systems that we use. More family time our clients are having, as well as ourselves are having to spend more time with our families, and better support and appreciation of the people we work with. These were some of the discussions that came out of that panel discussion, and it was I appreciated them, and I want to just leave some of those thoughts with us, looking at some of the high risk areas of COVID-19, and also, but yet looking at some of the advantages. And my last question for today is, what has been the most positive and yet negative experience with working with your clients during COVID-19 thus far? So that ends the training for today. I really, really hope this information has been helpful to you all. And this time I'm going to turn it over to Michelle for questions and answers.